And good morning, everyone. Phil Penarski here with CBS 42 Now. Hope you're all having a great start to your Wednesday. We are just a few moments away from hearing from Dr. Sarah Nafziger with UAB Medicine as she will provide a COVID-19 update from UAB's new drive-thru vaccination site in Wylam. It is at Faith Chapel. Again, we are expecting to hear from the doctor in just a matter of moments, and you will see it all live right here on CBS 42 Now. This is a live picture right outside Faith Chapel in Wylam. Again, UAB announced that they would be reopening their drive-thru vaccination sites at Faith Chapel as well as the Hoover Met. The Hoover Met one opened last week. As again, UAB says that they were expecting a large increase in possible requests for vaccination, so that is why they decided to reopen these drive-thru vaccination sites. I do want to remind everybody that if you head on over to our website, cbs42.com, you can find all of the latest information regarding the coronavirus pandemic and everything you need to know regarding the vaccine as well. Again, we do have some pretty interesting stories as of late over there, including a group of researchers in California who just received a grant about possibly creating a COVID-19 vaccine through the use of edible plants, including spinach and lettuce, as a new form to get people to get vaccinated rather than getting their 2 shots. It could be done as simply eating a salad. But we have so many more stories over on our website. I highly recommend everybody checking those out at the conclusion of this press conference. Again, that press conference that we're waiting on was scheduled to begin about 3 minutes ago, just appears to be running a little behind. But once again, you will see everything right here on CBS 42 Now. And as always, there will be a recap of this press conference, everything that comes out of it from Dr. Sarah Nafziger with UAB. We will provide it to you over on our website as well, and you can also find it by downloading the CBS 42 News app. It is available for free for all Android and iOS devices. And make sure you download that because then you can get alerted whenever we do have these live stream opportunities and these press conferences with UAB, Children's of Alabama, or everything else going on. It doesn't really necessarily have to be COVID related, everything happening across central Alabama and throughout the country. Again, we've also been following heavily on that Gabby Petito case out of Florida. Our sister station WFLA has been staying on top of that. You can get notified on all the latest updates there as well by downloading the CBS 42 News app. And it appears Dr. Nafziger has arrived, so we will send you there live now and hear all of her comments.
Why do you always want to do this when it's raining or the wind's blowing?
Supposedly it's clearing out. Yeah, that day at Parker.
I know, I'm really short, y'all. I'm so sorry.
That's all right. We keep overestimating that every time.
I
Like, she's
know.
kinda taller this time.
I'm really, really short. I was in the studio last week and I had followed Selwyn Vickers had done something and he's like tall as a tree. And there was a lot of adjustments that had to be made. Let's just say that. I was embarrassed.
Everybody ready? Yep, sir. All right, let's roll, Doctor.
Alrighty.
Hold up. Y'all want her to start off with an opening statement before questions? Okay.
Cool.
Whatever she wants to do.
That's what I'm talking about. If I could just get the rest of the world on board with that.
One at a time. Get this one out.
All right. Y'all let me know when you're ready.
We're good.
Y'all ready? Well, good morning. Thank you for being with us today here at the Faith Chapel Birmingham campus out here in Wylam community. We're really excited today to be announcing the opening of another community vaccination site here. So this is a great day for us, even though it is a little drizzly and rainy. It's really a great day for us. We're always excited when we're able to open another community vaccination site, because that gets us one step closer to ending this pandemic, which of course is what we all want to do. I'm going to start off today by giving you a little bit of an update about what's going on in the hospital. I think that's really important for people to hear. So right now we've got some good news, and then we've got some kind of bad news, I guess. So I'll start off with the positives. So cases are down statewide and hospitalizations are down statewide. So that's fantastic news. We're really excited about that. Just like we've seen with our previous surges, you know, we spike up in our cases, we spike up in our hospitalizations, and then they slowly come back down. So that's really good news for us here today. So what we're seeing in new cases in terms of those is those still tend to be in those younger populations. The children seem to be really driving new cases right now. And that's not a surprise, because guess what? They all went back to school recently, so nobody's surprised with that. So that's where most of our new cases seem to be. What we don't know still is how that's going to translate into hospitalizations for adults, because as we know, our children go to school, they go to daycare, they go to events, they get sick, they bring those germs home to us and get us sick sometimes. So we don't really know how that's going to translate into new cases in adults or into hospitalizations. But right now, both of those numbers, new cases in adults and hospitalizations in adults, looking good, improving. So that is great news. I told you there was a little bit of bad news too, so I'm going to go ahead and tell you that piece of it. And this is the part that concerns me right now, is the condition that our hospitals are in and our healthcare system as a whole. While our COVID numbers are down as far as our hospitalizations, we still have a tremendous strain on our hospital resources right now. And there are a couple of reasons for that. One is really just the acuity of the patients that we're seeing, both for the COVID side and for non-COVID patients. So for our COVID patients at UAB Hospital right now, about half of them are requiring ICU level care. And that's a whole lot more than we had in our previous surges. In our previous surges, about 30% of them would require ICU care. And right now, about half of them are in the ICU. And that's just putting a tremendous strain on our resources. These patients tend to be younger, and they're very, very sick. And when I go around and talk to our physicians in the hospital, what I'm hearing from them is not only are our COVID patients very, very sick right now, a lot sicker than we saw in previous surges, but also our non-COVID patient population is very sick right now and very ill. And, you know, we don't have numbers. This is not something you can see on a spreadsheet. This is about the practice of medicine. So I'm telling you what our physicians are telling me, what our nurses are telling me they're seeing, is people who had to have their care delayed during COVID when we weren't able to provide care for them. A lot of those folks got more sick while they were waiting on their care. And so they're just coming in very, very sick right now. So overall, the acuity level of the patients in the hospital very high right now, and it's continuing to put a tremendous strain on hospital resources. Our staff is exhausted. They are very tired. They're stretched thin. We do have some staff out with COVID cases, although that is improving. And we do have a lot of staff out who are having to care for their children who are sick. So various things like that are putting a tremendous strain on our staffing. So a little bit of good news this morning, a little bit of bad news. Our healthcare facilities are still under a tremendous strain, although hopefully there is a little bit of light at the end of this tunnel. Now I'm going to talk a little bit about vaccinations because that's really, you know, why we came out here today, and I want to give you an update on where we stand with those. So overall in our state, our vaccine rate is improving, and that's great news. I think a lot of people, you know, had told me they were waiting on that FDA full approval for some of the vaccines, and we have that now. So our vaccination rate is inching up. We've also heard from a lot of people who have unfortunately had a loved one or someone that they know that they were very close to who unfortunately had COVID and was very ill, or who unfortunately passed away from COVID. And so that's made a lot of people rethink and decide to go ahead and get their vaccination. So we are seeing those rates inch up slowly. And that's why we're here today to open this site, is we're hoping to go ahead and provide those vaccines just to make it as easy as possible for people who may have been waiting for one reason or another, who have decided that now is the time to go ahead and come out and get their vaccine. So what we're offering here at this Faith Chapel location is we are open Monday through Thursday. I know there had been some things out there that had said Monday through Friday, but it is Monday through Thursday from 8 to 1. And this site, you know, an appointment's always great because then we can get your paperwork done ahead of time. We can gather your information, get you registered, just a quicker in and out. You can get an appointment at uabmedicinevaccine.org. That's great. But if you didn't think ahead, if you're like me, sometimes you're a little last minute, go ahead and drive on through out here. We're glad to accommodate people who don't have an appointment also. Same thing at our Hoover Met location. We're happy to accommodate you as long as we have supplies and staff able. And right now we are in good shape on all those things. So would love to get everybody their vaccine. We're doing, we have the Pfizer product here. And we are offering first doses, second doses, and then we're offering that third dose for people who qualify for the third dose. And that is right now people who are suffering from immune compromising conditions. So, you know, what are those conditions? Well, there's a list of them out there. And what I'll tell you is this, you know, if you are, as an individual, think that you might have an immune compromising condition and think you qualify for that shot, then you probably do. So come on out, and we ask you to self-attest to that. We don't know your medical history and background. You know that. So you can come on out and let us know if you think you qualify for that, and you can get that third dose. We're especially worried about that group of people. There's a reason that the FDA approved that third dose for that group of people. It's because they're at the highest risk of severe complications from COVID, and we know that their original vaccines may not be as effective because of their immune status. So definitely those group of immune compromised people, we want to get them out here and get their third dose. But happy to get first and second doses also. I'm going to go ahead and stop there, and I'll be glad to take any questions you might have. Yes, sir.
We've done stories, obviously you guys know, the nurses are stressed, like you said, it's putting more stress on the system. So how do you guys offset that with nurses that already work for the MAC, and you said there's staff out with getting their family with COVID? Is there talk of bringing more traveling nurses in? How are you guys handling the situation to keep the hospital running as smoothly as possible?
Yeah, great question. You know, throughout the pandemic, before we even started, nationwide, we knew we didn't have enough nurses. This is not a new problem, but it's something that certainly has been brought front and center with the pandemic. I think it's really brought this problem into the spotlight, and we know that staffing is difficult, not only for nurses, but for other services. So our environmental services workers, guest services, you know, the people who clean the rooms, the people who bring food trays, the people who prepare the food. There are a lot of people who have to work together to deliver health care, and we have been struggling throughout the pandemic to make sure that we have appropriate levels of staffing in all of those areas. So, you know, I wish I could tell you a simple answer and say this is what we're doing to try to fix that problem, but it's really a long list of things. You know, we certainly want to make sure that, you know, we've looked at bonuses, we've looked at incentive pay. We're trying to do all kinds of things to make sure, first of all, that we're compensating our employees fairly and rewarding them for the very difficult work that they do. But we're also looking at other things and to bringing in more people to help them, to support them when they're carrying this tremendous burden. So is it easy? I'm going to tell you right now, it's not. And just like other industries, healthcare is really suffering from staffing shortages, and for us particularly, I think where we feel it, where we see it, is with nurses. And you know, I'd like to put a plug in for our nurses. Let me just say, when we're short of staff, when there's not someone available to come take the trash out of the room, who do you think that task falls to? It falls to the nurse. You know, when there's not somebody to deliver a meal tray, sometimes we'll see our nurses take on that burden and go get a meal tray. So our nurses do so much more than just delivering medications. They do a tremendous amount of work, and they really are essential to the delivery of patient care. So just a huge shout out to all the nurses out there. I know you're working so hard. They've really, you know, just like all the other healthcare workers, have carried a tremendous burden throughout the pandemic. And we just hope we can do everything we can to support them until we get to the end of this and can put it behind us.
Do you know at a time? Is that helping?
You know, great questions. I don't know the numbers offhand, Alan, but what I can tell you specifically is this. The number of traveling nurses that we've used has fluctuated, just as it did before the pandemic. It has fluctuated throughout the pandemic based on the demand, what we've needed. And so that number goes up and down constantly.
You're in this, are you in this community in part because you definitely want to reach out more to the African American community, get them comfortable, more comfortable over that vaccine hesitancy to get more people in this location?
You know, that's a great question. Why do we pick this location? Well, every location that we pick is driven by data. I know a lot of people like to think, well, maybe it was politics, maybe it was convenience. But really, for us, what we do at the beginning before we pick any site is we look at data. And why are we here at Faith Chapel? We're here because we looked at data and we saw that there are large pockets of people who are unvaccinated in the surrounding areas. And so we wanted to be here to provide vaccine for this community. We know that there are a lot of people who may be socioeconomically disadvantaged, and we want to make sure that we're here so that people who may have trouble getting a ride or who may have trouble accessing technology or have other barriers, we want to make sure that we're here to provide that vaccine.
Is vaccine hesitancy in this community still a problem for you?
You know, vaccine hesitancy is still a problem statewide right now. So in this community, yes. In my community, yes. In your community, yes. It's a problem statewide right now. And what we see is a lot of people, have looked at a lot of misinformation that's out there. And I'll tell you, there's a lot of it out there. And a lot of it looks on the surface very credible. And so what I would encourage people to do is to look at those real sources of information. I saw, it's kind of tongue in cheek, but somebody said the other day, real scientists tend to not publish their data on YouTube. It tends to be in actual scientific journals. And I think that is so true. And I don't mean to sound flippant about that, but people see a lot of things on social media and tend to believe what they see. But really what you need to do is go to the sources of truth. And for us, that's the CDC right now. That's the first place that physicians go to. We look in our medical journals for truth, and we look to those trusted resources rather than something that might be out there that's not peer-reviewed and not validated.
Doctor, you've also had a location that opened up recently over in Hoover outside of Met where you've been before. And that's also scheduled by appointment. What kind of demand for vaccines? You've talked about hesitancy. What kind of demand have you seen at that location compared to the last contact?
That's a great question. Since we opened that location, we have had decent demand at that site, although the numbers have not been as high as they were during our initial vaccine push. But what we've seen is a lot more people not only coming to get their first and second doses, which is great news for us, but we know that there are a lot of people who had already gotten their first and second doses who need that third dose. So we are seeing some of that as well. So overall, the numbers are not as high as we saw with our initial vaccine push, but every single person we get vaccinated matters, and we're just so happy that we are seeing some of that out there for sure.
Are you able to say, are the majority of people at that site, which is one just open, are they coming for those first and second shots, or a majority of them seeking that first booster?
The majority of what we're seeing right now is first and second shots. So that's really reassuring to me. I kind of thought when we opened these sites it would be more the third shots. So I was wrong. I'll go ahead and say that. Really, we are seeing a lot of first and second shots, and I'm super thrilled about that. Why is that? I don't know, because let me tell you, you can get your first and second shot. You can find vaccine on just about every pharmacy in the state right now. It's everywhere. But, I guess a lot of people like the convenience of the drive-thru, and maybe it makes it more visible, bringing it to the community.
Can we talk about how many vaccines? You know what?
I don't have the numbers off the top of my head, but we'd be glad to provide that later.
Okay, can we talk about the new R1 variant? A lot of healthcare professionals are talking about it. Is that something UAB wants to get out there? We want to get ahead of it, or?
Yeah, the big concern we've had all along is what variant is next. We've talked all summer about Delta and how it has really just taken us for a ride. And what's next? There are other variants out there right now that are concerning, that we're watching closely. But the story right now is that we don't know enough about it yet. But that's why it's so important for us to get everyone vaccinated, because if we can stop these in their tracks before these variants take hold, before we give the virus opportunity to change again, then we can put this thing behind us. What I worry about is what if, we don't have enough people vaccinate, we give the virus time to change, and then all of a sudden we get a variant out there that the vaccine doesn't work for, and then where are we going to be? So right now is the time for us to take action. We're on the good side of this Delta surge, so this is the perfect opportunity. If you haven't got your vaccine yet, go ahead, come on out, get it. Let's get that over with, put this thing behind us.
How's the word getting out to the community? Obviously putting on the news and stuff, but how are you guys down to communicate, come here and do this, it's free, it's available?
That's a great question, Alan. We have tried so many ways to get the word out, and going to the media, we appreciate our media partners really trying to get the word out with us. We're putting things out on all of our social media campaigns. We've partnered with a lot of community engagement workers recently to get out in the community and really try to get the word out. So at this point, I'll be honest with you, we're hoping that everybody who sees this, everybody who knows about us, if there's a person you care about, a person you love, maybe a person in your church, a person in your neighborhood who maybe not be vaccinated, maybe now's the time to have a conversation with them. Say, are you ready? Do you need a ride? Do you need help? Is there something I can do to help make sure that you're able to get your vaccine? Now's a great time to go ahead and do that and reach out. People have asked what they can do to help the healthcare workers right now, and that's what you can do. We don't need you down at the hospital right now volunteering. We need you in your community, boots on the ground, helping your friends and neighbors get vaccinated.
Doctor, how long are you all prepared to keep both of these sites open?
So, with all of our vaccine sites, it's a tremendous expense. I'm not going to sugarcoat that for you. It costs us a lot of money to be out there and a lot of resources. We have these 2 sites open, and we also have a site on our campus that's focused on our employees as well. So it's a lot of resources. But what we've said with each site every time is we're going to be here as long as there's demand. We want, this is a top priority for us, is getting this pandemic over with, getting everybody vaccinated. So as long as we have community demand, we'll be here. And when we get to the point where we're just really seeing that, hey, we're pouring all these resources into this, but we're not getting a lot of return for that, at that point we'll start thinking about closing them down. But for now, we're going to be here. Now, what do we think might come up in the future? We know that on last week, the FDA, they had a committee that recommended vaccine boosters for certain groups, not for everyone, but for certain groups of people. And so we anticipate that we may see recommendations that expand that 3rd dose category. And so if we see that, I think we definitely will have a lot more increase in demand for that 3rd dose as well.
States can cut almost 18% of monoclonals this week. I don't know if that translates for UAB. Do you have concerns about potential cuts, and do you believe these cuts are going to lead to more hospitalizations, and it's a catch-22? Do you believe that's going to happen?
I'm so glad you asked that question. So monoclonal antibodies are one of the best tools we have once people become infected with COVID to keep them from ending up in the hospital. And we focus those on our most high-risk population. So throughout the pandemic, that's something that we've really tried to focus on, is getting those high-risk COVID-positive patients treated with monoclonal antibody therapies. And they've worked pretty well, so we're really excited about that. There's been a lot of talk recently about a change in the way they're distributed and a cut to the allocation to the state of Alabama. What I can tell you is right now at UAB, we are good on monoclonal antibody supplies. We have enough. We understand that the allocation process now will be based on cases in your state. And remember, I told you our case numbers are coming down right now. So our allocation is also a little bit down right now. So right now our supplies are good. Now, if we get in a situation where we have patients who need monoclonals and not enough supply, we will definitely, that is not good, and we will be reaching out to you, and we will be making a lot of noise about that. But right now, we're good, and so we're not out here complaining about that because we're good on those supplies right now. If that changes, definitely, though, we're going to be making some noise about that because we know that that is an effective tool to keep COVID-positive patients from becoming critically ill. So right now, good on monoclonals. If that changes, we'll let you know.
Alan asked a question earlier about travel nurses. I know the state is getting some amount of nurses through some federal COVID funds, but they're going to use money for this. What is the need, if any, exists right now? You mentioned some employees are sick, for travel nurses at UAB, and is UAB one of the hospitals that will take advantage of the nurses that
Yeah, throughout the pandemic, we've heard a lot about different resources for staffing, and we've answered a lot of surveys from different federal and state agencies about our staffing situation and how many staff we need. And so, that has happened again recently. Certainly, if staff is offered to us, we'll take it because just like every other hospital in America, we need staff. So we all are desperately needing staff to work. And so if those resources are offered, we'll gladly take them. As far as I know, right now we have not received any of that. But certainly, we're looking right now to whatever resources are available out there and really trying to think outside the box with that. But as far as I know, right now we have not received any through the specific program you were referring to.
All the numbers looking going good on one half. Death numbers, I think that's still a concern. I think that we can expect them to come down, or are we going to continue to see these high numbers roll for a while?
Boy, I certainly do hope the death numbers come down because that's something that's super concerning. A lot of our hospital beds that have opened up recently have opened up because patients are dying from COVID. I saw some numbers this morning that said last week, I believe Alabama had over 500 deaths due to COVID in our state, and that is an all-time high for the pandemic. We don't like to talk about that a lot. It's not often you're going to see somebody representing a hospital in my position come to you and stand in front of the camera and talk about the numbers of patients who are dying. But I'm here to tell you it's very real. A lot of people continue to die, and it's very disheartening to us in healthcare right now. And the reason it's so disheartening is it's largely preventable deaths at this point in time. Just like we would be upset if we were talking about more than 500 people died from drunk driving accidents last week. We're upset standing here talking to you today about more than 500 people dying of COVID last week because we have a very safe and effective vaccine that can prevent these deaths. So it's very disheartening to us in the healthcare community right now to be seeing these deaths continue.
I have a question real quick. Talking about, we're 6 months out from being 2 years into this. If we look at the long game, with the Delta variant, we're going into the holiday season's coming up again. A lot of people will be traveling again, and I think you feel like that's where Delta kind of bore out of that last year, coming into this year. How is the hospital prepared for that long game, long term, if the season repeats itself?
That's a great question, and I'm going to tell you here's what I'm thinking about. I'm certainly thinking about the Delta variant and recovering from this wave, but in planning circles, emergency management circles, what we're really thinking about is what's going to happen this winter, because as you know, flu season was kind of didn't happen here last year. We didn't have flu. People were masking. We had good flu vaccine uptake, and flu season kind of really didn't happen in Alabama last year. Now, when you go places, look around. Nobody's wearing a mask right now, most places, other than if you go in a healthcare facility where it's required by our regulatory bodies. So, most places you go, people are not masking. Well, what does that mean for flu this year? I think we can expect that flu season's going to take off. And if you pair a COVID surge with that, I'm very concerned about what we could see this winter. I don't want to be Chicken Little and say the sky's falling at this point in time. But it's my responsibility as leaders in the healthcare community, it's our responsibility to prepare for those things. And the writing's on the wall that this winter could be ugly if you pair a flu surge with a COVID surge. The big unknown for us is what COVID variants lie out there and how many Alabamians are going to get vaccinated between now and then. So, we're hoping that we can keep getting those vaccine rates bumped up, not only for COVID, but for flu shots. Both are very, very important. So if we can see good vaccination rates, hopefully if we keep our fingers crossed and everything works out well, we'll get through this winter unscathed. But we do have a setup that could potentially be ugly, and it's something we're watching very closely. Thanks, y'all. Appreciate it.
And that was Dr. Sarah Nafzinger with UAB Medicine as she gave an update on the COVID-19 pandemic from UAB's new drive-thru vaccination site in Wylam at Faith Chapel. Once again, Phil Penarski here with CBS 42 Now. If you look to the right of your screen, that is the Alabama Department of Public Health's COVID-19 dashboard that is available at all times over on our website, cbs42.com, for you to check out. It's very interactive, and that way you can slowly monitor everything going on across the state. As you can see, right now, 64 out of the 67 counties across Alabama are considered high-risk transmission areas for contracting COVID-19. But there is good news. I do want to go over some of the things that Dr. Nafzinger discussed in this press conference. She opened up with some very good news that cases and hospitalizations across the state have slowly started to dwindle down. She said that this is not uncommon. We've seen it with all the other surges of COVID-19 that have happened so far in the state. But one thing she did say that is sort of bad news is the fact that there is still a very large strain on hospitals across the state, specifically in UAB, as they try to handle everyone. Right now, about half of all COVID-19 patients who are currently being hospitalized at UAB are in need of ICU care. That's something that Dr. Nafzinger really stressed on. That's putting a lot of strain on hospitals there. But the vaccine rate across the state is also improving, which is very helpful considering that flu season is slowly approaching. Dr. Nafzinger making mention to get that flu shot because we frankly did not see much of a flu season last year in Alabama due to the large amounts of COVID-19 restrictions and precautions given to all businesses and areas, and most people were staying inside at that time with flu season. But now that restrictions have sort of dwindled down and eased off, she is encouraging everybody to also get that flu shot. Once again, there will be a full recap of this press conference over on our website, cbs42.com, in just a matter of moments. And while you're there, be sure to check out some of the other COVID-19 related stories we have. We have everything you need to know regarding the vaccine, vaccination sites, the booster shots. Again, the drive-thru vaccination site at Faith Chapel in Wylam will be offering both first, second, and third doses. Those third doses being those booster shots that are recommended for all immunocompromised individuals. Those will all be offered there as well. And also at the second drive-thru site that UAB is holding at the Hoover Met. Again, a full recap will be available over on our website in just a matter of moments. We want to thank you all so much for tuning into this latest edition of CBS 42 Now. I'm Phil Penarski, and we hope you have a great rest of your day.